could this be a liver injury?
Right, right. So, I mean, is this kind of a death sentence? Like, my first thought would there's a problem with hemodynamics. You know, he needs blood. We need to get oxygen. We need to get perfusion to that liver. Like, how on earth would I even begin to start walking this back?
I mean, basically, you support the liver as an organ system the way you support all other organ systems in shock, right? You treat the cause. So, if it's hemorrhagic shock, get the bleeding under control as best as possible, ideally, definitively, if not as best as possible, and then you resuscitate with the appropriate resuscitation, which in this case is going to be whole blood. Whole blood in the setting of acute liver injury and the coagulopathy that happens as a result of that is super useful because you've got the richest concentration of clotting factors, platelets, and fibrinogen in whole blood than in 4-factor blood, where it's more diluted by citrate. I should say another another concerning sign of acute liver injury is coagulopathy, right? So you're resuscitating this guy, your patient, and he's still bleeding, especially bleeding from things that shouldn't be bleeding, like IV sticks or blood in the Foley catheter. That's got to raise your level of suspicion.
Yeah, like any kind of cut small things in the mouth, nosebleeds, things like that.
Your Crike site, any place you did an intervention. Exactly. So glucose, lactate, and bleeding are really the three things that you have in the field that can diagnose this. And then labs, if you want to talk about them, we can talk about them just for awareness, but most of those are higher level.
So, I mean, I kind of assumed that really the only thing you can do, try to maintain perfusion, roll back whatever the cause was the best as possible. If he was hyperthermic, try to make him euthermic the best you possibly can. That seems like the logical thing to do. I guess what I don't really understand is you have a liver that's failing, coagulopathies are going crazy. He's not creating any proteins. There's lots of things that are falling apart. How do I do the obvious to maintain this organ system while simultaneously it's desperately trying to screw